All right. Hello, everyone, from wherever you are joining us. On behalf of the organizers of this webinar, I want to say welcome to the 23rd episode of Insight Webinar. So for the benefit of those who are just joining for the first time, who maybe you saw the flyer and you registered and you're just curious or you're interested in discussions around climate change. Insight Webinar is a public health webinar series hosted by eHealth Africa. And this webinar series enables insightful conversations with public health professionals on issues and pathways for improved public health care delivery. My name is TJ Ojumo, and I will be your host for today's conversation. So to quickly give us a brief background of the conversation we will be having today around climate change. It will interest you to know that the impact of climate change has been described as multifaceted. It impacts the physical environment as well as all aspects of both natural and human systems. This also includes social and economic conditions and the functioning of health systems by implication. According to the World Health Organization, over 3.6 billion people already live in areas highly susceptible to climate change. And it's expected that between 2030 and 2050, climate change impact will cause up to 250,000 additional deaths per year. Now, the unpredictable and inconsistent nature of changing climate is increasingly posing a significant threat to public health and impacting various aspects of individual and community well-being. Now, despite the efforts that have been, invested in interventions around climate change threats, a lot still needs to be done to avert potential public health emergencies as a result of climate change. And today, this 23rd episode of Insights Webinar will provide a comprehensive overview of climate change, its impact on public health, and this webinar will explain strategies and how public healthcare systems can respond to potential climate change healthcare emergencies. So our panelists, we have three wonderful panelists, and they are seasoned experts and leaders who have invested time and resources in creating awareness and implementing interventions to mitigate the impact of climate change on humans. And honestly, I'm excited to have them here today. I'm looking forward to the conversations, and I'm sure that you will be able to take more than just one thing home from today's conversation. So I'm going to introduce our panelists in no particular order. And I'm going to read a short bio. And when I do so and call on you, please kindly unmute your microphone and say hello to our audience. All right, so in no particular order, the first panelist that I will be introducing to us today is none other than Zila Waminaje. She is a digital and public health consultant with Salient Advisory in Canada. Zila is a digital health and public health professional. She provides market intelligence insights on African health tech. She has managed the design and implementation of several digital health initiatives and solutions for sexual and reproductive health. She has also worked on health information management systems and public health emergency management programs. She has a master's degree in public health. Ladies and gentlemen, please welcome with me Zila Waminaje. Zila, can you please say hello to our audience listening?
Hi, TJ, and hi, everyone. I'm happy to be here. Thank you.
All right. We're happy to have you here too. All right. So the next person I'll be introducing is none other than Temitayo Telala. She is a program manager and also the program lead for climate adaptation in health, food security, and nutrition at eHealth Africa. She's a public health management expert with over 11 years experience managing complex public health and development programs in Nigeria. She holds a Bachelor of Science in Physiology and a Master's degree in Public Health. She is also a Prince 2 certified practitioner with certifications in adaptive project management, change management, and planning strategies, as well as climate change adaptation, mitigation, and resilience. Please welcome with me, Madam Temitayo Telala. Madam Temitayo, Please say hello to everyone listening.
Hello, everyone. Thanks, Sue. Happy to be here and look forward to the session.
All right, thank you very much. All right, and last but not the least, all the way from University of Public Health Makerere. He's an academic and a researcher. I'd like to introduce to us all Dr. John Bosco Isunju. Dr. John Bosco is a distinguished academic and researcher with the Makerere University School of Public Health. His work is dedicated to advancing knowledge and practice in climate and health, environmental pollution, geospatial health, disaster risk reduction, infection prevention and control, occupational safety and health, safe water, sanitation and hygiene, that is WASH. Dr. Isunju recently led the climate change vulnerability and adaptation assessment and development of the Health National Adaptation Plan for Uganda. He is a member of the WHO Global Alliance for Transformative Action on Climate and Health. He has collaborated with esteemed partners in the climate and health space, including the Rockefeller Foundation, WHO, Seed Global Health, Pathfinder, Clean Health Access Initiative, the Uganda Ministry of Health, the Ministry of Water and Environment, among many others. Please let us welcome Dr. John Bosco. Hello, Dr. John Bosco. Can you please unmute your mic and say hello to our listeners this day?
Yes, good afternoon and good morning, colleagues, and welcome to this webinar.
All right. Thank you very much. So we're getting to the most exciting part of this meeting, which are the questions that we'll be dealing in. And please, I'd like to remind you as the conversation goes on, I'm sure that many people will have questions. Please kindly use the Q&A box on your interface to send in questions. And when we get to towards the end of the webinar, we will be able to take your questions. So in case you have questions directed to specific people, you can also indicate that and they will be responding to your questions. Okay, so the first question I'll be, asking, and this will go to all of our panelists today, is how do you explain climate change and its impact to a layman? And I'd like Madam Temitayo to respond first. How do you explain climate change and its impact to a layman?
All right, thanks, TJ. So can you confirm you can hear me loud and clear?
Yes, I can hear you.
Okay, so in defining or explaining climate change, I would say that climate change simply refers to the significant changes in global temperatures and weather patterns over time. And this is largely caused or primarily caused by human activity over the years, over decades, centuries. And this human activity that has been pinpointed to cause the climate change is largely burning of fossil fuels. And this releases what we call greenhouse gases into the atmosphere. To explain the greenhouse gases in a bit more detail, the greenhouse gases are naturally occurring gases in the atmosphere that trap heat from the sun, keeping our planet warm enough to sustain life. However, with the increase in the release of these gases over time, like I said, due to human activity, this has led to more heat being trapped in the atmosphere, and it resulted to the phenomenon that I think we commonly call the global warming. And this significantly or has significant impact on the environment and life on Earth in general. Research has shown that the burning of fossil fuels accounts for over 75% of greenhouse gases emissions globally. And some of these gases include carbon dioxide, methane, nitrous oxide, and fluorinated gases. There are other contributors to climate change, and some of these include deforestation, agricultural practices, looking at increase in livestock farming, use of fertilizers that contain nitrogen, overfishing. There's also a component around industrialization and urbanization that all are directly or indirectly as well linked to increased emission of these greenhouse gases. And then when you look at some of the impacts of climate change, so the impact of climate change, the causes are multifaceted, the impact is also quite multifaceted. I already talked about the temperature rising or the temperature rise due to climate change. We also have impacts around extreme weather events, looking at increasing occurrences of heat waves, hurricanes, droughts, floods, amongst other things.
Okay, I'm going to interject you a little bit. I don't want you to go into my next question. So I know that you have a whole lot to unbundle for us today. So just allow me to
okay, so let me just wrap it up at that. Okay, thank you.
Yes. All right, thank you very much. Okay, so I'll go to Dr. John Bosco briefly and quickly. How do we have people, not everyone on this call is a climate change expert. There are people who want to know what it's all about. They've been hearing it, they've read it in the news, they've heard people talk about it. They want to know, what really is this climate change and how does it affect me as a person? So how do you explain it to a layman, Dr. John Bosco, and its impact? How do you explain it?
Okay, thank you very much, Chair. To a layman, how you would explain climate change, you have to start with what they actually do. If they are into agriculture, you look at how it is affecting their productivity. If they are working in the sun, you have to look at the extent of exposure, and then the pollution, the air quality associated with it, prolonged dry seasons, and of course the challenges that they meet with access to safe water, with prolonged droughts, and the floods, of course the hazards that they actually see. It is easier for them to associate climate change with what is visible within their context. If they are livestock farmers, and if at their workplace, how do they manage to access their workplace with a broken bridge? Yeah, on a hot day, how do they manage to survive the heat waves? So it has to relate to what is actually they experiencing directly, as opposed to looking at the global context of climate change when they don't get the opportunity to really look at the global context.
Thank you very much, Dr. John Bosco. I think that's a very, very interesting perspective for anyone who's on the call who is also a climate change expert. When you're trying to speak to people who are not technical in that sense, and you want them to really understand, I think what you've just shared is a very, very good way to really bring people in, to the conversation using relatable experience and not, only the global perspective of climate change. All right, so finally, Zila, could you please share, what's your perspective? How do you explain climate change to a layman?
Okay, so for me, I don't know whether it's my background as an anatomist, but I like to use the human body to explain. So as a human being, as you're getting older, definitely your body undergoes like changes just as a result of like the natural aging process. But then if you take care of your body as you should, adopt the healthy habits they always talk about, you have a higher chance of remaining healthy for a long time. So in a similar sense, the environment and planet is also aging, and we need to take care of it so that it can remain healthy and continue to serve us and future generations for a long time. In terms of like what Temitayo and Dr. John have even mentioned relating to like the global warming, and how I like to explain it is that I would say I look at the human body still. The normal temperature is like 37 degrees. And then when it becomes too high, you have a fever, and then that signals that something is wrong. And that's what we're seeing in the current, in our current environment, where they're talking about global warming, the earth is hot. And now we're seeing all these extreme temperatures, shifting weather patterns and the rest. And when you're sick, you have a fever, you try to carry out like activities also to help you cool down your body. So in the same way now, as the earth is eating up, we need to reduce activities that are causing that heating, and try to like plant more trees, reduce the burning of fossil fuels and all of that. And at the same time, still prepare for the effects of the natural evolution of time and what's going to happen. Yeah, thank you.
All right, thank you very much, Zila. I like the fact that you're able to explain it from your own perspective, or connecting it to your own background or your discipline. I think that with more people understanding what climate change is about, they will be able to also, further educate others, with relatable experiences and perspectives. All right, so the next question I'll be, asking will go to Madam Temitayo. And what are the emerging public health threats posed by climate change that we should be concerned about? What are the emerging public health threats posed by climate change that we should be concerned about?
Okay, thank you, TJ. So just to say that I quite liked Zila's explanation of climate change using the human body. And then in that context, when we say what are the emerging public health threats posed by climate change, I think I already started to talk about some of the issues and some of the occurrences that we're starting to see based on the earth getting hot. And I'll say that climate change has been described as the single biggest threat facing humanity. So it's just to put that in context for us to understand and to appreciate how serious this phenomenon of climate change and the occurrence of climate change is. And this threat is particularly more severe, particularly in low middle income countries and resource constrained settings where healthcare systems are already overstretched and overburdened. And some of these impacts or this public health threat could be direct or could be indirect. So for instance, talking about the extreme weather patterns as a result of climate change, this can have both direct and indirect impacts on health. Climate change intensifies extreme weather events like hurricanes, storms, and these events can cause injuries, deaths, displacement of populations, even mental health issues, leading to both immediate health impact and even long-term health impact to affected populations. With climate change, we're also seeing increase in the incidence of disease outbreaks and even the spread of diseases. Looking at vector-borne diseases, waterborne diseases, foodborne diseases across board. There's also issues around air quality degradation, which has also been linked to increased incidence of respiratory and cardiovascular diseases. So all of these are some of the immediate and even long-term impact of climate change. Another key or important public health threat is to food security, the effect of climate change on food security. So with the changes in climate, this influences agricultural production and even crop yield, which we're starting to see also translates and leads to situations of malnutrition, food insecurity, particularly across Africa, like I said, and low middle income countries. So these are some of the, some of the immediate and emerging public health impacts or threats posed by climate change in our communities and amongst our populations.
Thank you very much, Madam Temitayo. I think that the effects of climate change, we can all agree they are far-reaching. And I think that, we have not even exhausted the list of, potential hazards that, can occur as a result of, this climate change. I don't know that, Madam Zila, do you want to contribute, from your own knowledge also to what are, maybe some public health threats that Madam Temitayo has not touched on yet?
Yeah, I mean, it's kind of, she kind of like covered it comprehensively already. But just to summarize, I would say when we think about the basic things that we need as human beings, we always say food, shelter, water. And these are the aspects that climate change affects. In terms of food, she talked about nutrition, food security. When we're not getting crops, we're not getting the scarcity of food, obviously, leads to malnutrition. When there's cases like flooding, next thing we know, we're seeing like diarrhea diseases like cholera disease outbreaks everywhere. And in terms of shelter, when there's like a landslide, people are displaced, in fact, if like IDP camps or refugee camps, you know that it's easy for diseases to spread there. It's very, very easy for outbreaks to come from those kind of like populations. And then let's not even, maybe I think one aspect we didn't reach is the mental health aspect of it. These are little things. I know I don't know if you're online, we see people in London, for example, always complaining about the rainy weather and how depressing it is. And when the sun is out, everyone comes out. But it's easy to just look at it as a joke, but these are actually the kind of impact that the climate and weather has on our mood and on our mental health. So it's a really, really important public health issue that needs to be attended to.
All right, thank you very much, Zila. So the next question I'm posing is to Dr. John Bosco, and this is the question. What measures can governments and communities take to mitigate the health risk of climate change? So from, Madam Temitayo and from Zila, they've spoken about some of the, the potential risk and that climate change poses to the health of people. Madam Temitayo, while speaking, she spoke of vector-borne diseases. She spoke about health, air quality, and how it's linked to a lot of respiratory diseases and so much more. So what measures can government and communities take to mitigate the health risk of climate change? Dr. Bosco, John Bosco, over to you, sir.
Thank you very much, Chair. And just to add on to my colleagues and to say that when you're talking about health, you're looking at the health outcomes, which are the diseases, the effect on human health, the mental health, the malaria, all these other, what we are calling health outcomes. But we're also looking at the effect on the health system, the building blocks of the health system, the referral systems, the information systems, the infrastructure, the energy systems. All these are vulnerable to climate change. And when the health system is affected, it cannot deliver the services to the communities, the affected communities. So what can governments do? The WHO guides us through a framework of building resilience of the health system to climate change effects, which we are calling the climate adaptation strategic components, pillars. And these are 10. I will just briefly go through them and make it easier. So the first component that we need really to look at is have a climate transformative leadership and governance. That's the first thing. You must put in place structures and guidelines, the different instruments that you need to implement policies, strategies, and guidelines. The next component is ensuring that you have a climate smart health workforce. They know how to make climate mitigation adaptation plans, how to predict and prepare, how to budget. And then component 3 is assessing the level of vulnerability, capacity, and capacity to adapt, to recover, and to prevent. So assessing these vulnerability and adaptation assessments, what we're calling the VAA, one which we have already done for my country here in Uganda. The fourth component is integrated risk monitoring and early warning. Governments need to invest in monitoring across all sectors that are vulnerable to climate change, and then putting in place early warning systems. The fifth component is health and climate research. You can't do anything unless you're going to generate evidence that is based on what is happening on the ground. If you have to control malaria, you need to know how climate change is actually moderating the occurrence of malaria. The sixth component is climate resilience, infrastructure, technologies, and supply chain. If, for example, you're going to ensure coverage of vaccine services, immunization services, you need to ensure that you have climate resilient system, chain that will ensure that you reach the last mile delivery. The seventh is management of environmental determinants of health. You look, for example, at the breeding sites, environmental degradation, sensitizing the communities on how to really protect the environment, plant trees and protect catchments, protect water sources. And then the eighth is climate-informed health programming. There is a need to link health epidemiology with climate epidemiology, climate data and health data, so that you can know that you're going to have maybe a certain weather event that will moderate a certain health outcome. And then you design your health programs based on that information. Component 9 is about climate-related emergency preparedness and management. Most of the time, we experience climate-related emergencies like floods, especially those which are quick onset or rapid onset, like floods. Droughts, you will see it coming and you can see the crops not prepare there. But for quick onset, you find the governments are not prepared. Kenya has been going through a lot of flash floods. Same day with the US right now. And if you're not really prepared in advance, you get problems. And the last one, which is the 10th, is sustainable climate and health financing. Most of the time, the climate change related funds come targeting other areas. Maybe they are targeting the carbon, reducing the carbon footprint, or other areas that may not necessarily be aligned to health, but we need to be innovative and package our programs such that we tap into the climate change funds to support health. Those are the 10 pillars that we need to consider, or governments need to think about in building resilience for the health sector.
All right. Thank you so much, Dr. John, for that short masterclass in climate change health risk mitigation. I'm sure that a few people must have picked on, quite a number of those pillars you spoke about: ensuring a climate smart workforce, assessing the level of vulnerability, capacity to adapt, to recover and prevent, generating evidence, climate transformative leadership and governance. I have my notes full here. Thank you very much for that insightful contribution, Dr. John. All right, so my next question goes to Zila. So we just, spoke about mitigating the health risk of climate change. And one of the things that Dr. John talked about was creating climate resilience in infrastructure, or he spoke about, creating a framework to build resilience to climate change effect. So now, we have our own framework here in Nigeria. We have our public health system. So how are climate change threats impacting our public health surveillance and response? So we're trying to narrow down now on the surveillance and response part, of our health system. How are climate change threats impacting our public health surveillance and response? So this question is for you, Zila.
Okay, definitely it's complicating processes related to public health surveillance and response. When we look at the frequency now and intensity of events such as like flooding, you see that there's greater need for our surveillance plans, just as Dr. John has said, to be more flexible and adaptable. Let me give, for example, a major aspect of public health surveillance is preparedness. For example, you see, I'll use the rainy season as just to buttress a point. So during the rainy season, you know that, okay, this is normally comes from this time to this period, and some areas are more likely to experience flooding. And we know that when flooding comes, there are necessary emergencies that will arise, and then you organize like health products, supplies, and just organize logistics in place to attend to them. But then after putting your measures in place, you're not seeing that this event is happening earlier than expected. And so as this unpredictability happens, you then have to be very proactive and flexible with your plans, to make sure that you're able to respond immediately and help people. And when you also consider things like even immunization campaigns in communities, you've created your micro plans, that, okay, you're going to reach this community, this is your catchment area, all of that. But now the next thing, the road to a community is being washed away, maybe by a heavy rainfall or something. So now you have to think, is this settlement going to be missed during this campaign, or what do you do? So obviously, these are some of the ways that climate change, like I would say, is impacting public health surveillance and response. And so that's why I would say collaboration with like multi-sectoral partners are really important. In Nigeria, I know we have the multi-hazard emergency response plan. I think it includes collaboration with like Ministry of the Environment, Agriculture, and even the NEMA too. And so that's, let's say, partnership and cross collaboration is really, really important.
All right. Thank you very much. Like you rightly said, collaboration is really important. If you're just joining us, I want to welcome you. This is Insights Webinar, the 23rd edition. And, we're in the middle of conversations around addressing climate change threats to public health. We have 3 panelists who have, been giving us very insightful thoughts, around the subject matter. Please, if you have questions, kindly use the Q&A box. I can see some questions, coming up in the chat box. Please kindly use the Q&A box, and we will take your questions towards the end of the conversation. All right. So one of the things that Zila, you mentioned while you were answering the question around the impact of climate change threat on public health surveillance and response, you talked about the need for flexible and adaptable surveillance systems. So now I'm going to throw this question to Madam Temitayo. What are the adaptation strategies that public healthcare systems can deploy to respond to potential climate change health emergencies? This is for you, Madam Temitayo.
All right, thank you. So I think that Dr. John Bosco and Zila have started to discuss or talk around some of these adaptation strategies. And I will start with the policy environment. Looking at using Nigeria, for example, we tend to see that at the national level, there are different policies, regulations, and governance structures around climate resilience, climate adaptation, and mitigation. But you tend to see that this is not, this doesn't trickle down when it comes to, for instance, state level, community level, household level, and even individual levels. So I think the very first adaptation strategy that I would say is having or establishing policies, regulation, and governance structures that support climate resilience public health strategies at the national level, and also advocating for the adoption and domestication of these policies at the subnational level. There also needs to be collaboration with policymakers to integrate this climate change adaptation into health planning and emergency preparedness frameworks across the different, across the different levels. Also, another adaptation strategy will be looking at enhancing disease surveillance and early warning systems. So Zila, I think, already mentioned or gave some examples around disease surveillance and how climate change affects that. So to be able to properly adapt to the effects of climate change, we need to establish robust surveillance systems to monitor climate-sensitive health outcomes, and also develop early warning systems that alert healthcare providers and communities about impending or extreme weather events or disease outbreaks. And that way, we're able to properly respond to plan and then to respond to some of these issues. We also look at emergency management and disaster preparedness, particularly looking at the healthcare system and healthcare workers. So it's one thing to have the policies available, domesticated the framework, but we need to be able to build the capacity of healthcare workers, public health officials, to be able to develop plans, mitigation plans, adaptation plans, and also to be able to implement them across board. Because if that doesn't happen, then these plans and these strategies really fall short or stop at the bulk of the government at that level. There's also adaptations around renewable energy. So use of renewable energy solutions or deployment of renewable energy solutions, looking at solar panels or solar power, wind turbines, and things like that, to also help reduce carbon emissions and greenhouse gas emissions in health facilities or across health facilities. That is also a very key component. Also looking at the Nigerian context, where we currently have, let's say, erratic power supply, particularly in hard-to-reach locations. This, I think, proves as a very, very good adaptive strategy, not just in terms of reducing carbon emissions, but also being able to strengthen the quality of care that is provided to populations across board. I think last I would talk about is also community engagement and education. So the awareness level around climate change needs to increase. Not just at the national, not just at because climate change affects us as individuals, as households, and then communities, and then trickles all the way. So there needs to be that awareness amongst individuals, amongst households, among communities, and there needs to be promotion of behaviors that reduce climate-related health risks. We also need to be looking at strategies around engaging community leaders and organizations to enhance the local resilience and response capabilities across board.
All right, thank you very much, Madam Timotaya, for that robust answer. Please, again, I'd like to reiterate, if you have questions, kindly use the Q&A box on your viewing interface, and we'll take your questions at the end of the conversation. All right, so you spoke about collaboration of policymakers with those at the helm of affairs of planning systems. So I'm asking Dr. John Bosco right now. Dr. John, what are the critical steps that need to be taken to integrate public health into climate change policies and planning? What are the steps that need to be taken to integrate public health into climate change policies and planning?
All right, thank you very much again. First of all, we need to know what policies are we talking about right now, and at what level. So right now, governments are fragmented and they're working in silos. Although in some governments have cross-cutting entities that coordinate them through, for example, the Prime Minister's office, you find there's coordination. So we need to sort of leverage those coordinating entities so that they can coordinate cross-cutting interventions. Many governments are already taking climate change as a cross-cutting issue, and they have systems in place of enforcing ministries, departments, and agencies and other non-state actors to integrate and mainstream climate change in their programming. However, little attention has been paid to mainstreaming climate and health, because it is only coming to a fore lately. It's just COP28 and COP26 is begun to be heard about, and now governments are responding to make strategic plans. So it's very important to have coordination mechanisms, lead agencies for climate and health, particularly now looking at the Ministry of Health as the lead agency for climate and health, but working very closely with the other lead agencies, like usually ministries of water are the lead agencies on climate change programming on the side of government, but then the ministries of finance lead on climate financing. So those critical stakeholders need to work together, and they need to have MOUs at that level that really lay out commitments and a very clear framework on how they can engage the private sector, how they can engage the partners, the funders, because everyone now is interested in climate change, including the embassies. Everyone wants to have a footprint on ground to showcase that they have done something on climate change. And some already have funds that are targeting certain areas that are very much related to climate change. You may find a World Bank or maybe Global Fund is funding malaria and maybe tuberculosis. But these may actually be linked to climate change. And if you can innovatively write proposals that can harness those funds, then you will be attracting funds to mitigate the effects of climate change from other streams. That's the quick sort of put forward.
All right. Thank you very much, Dr. John Bosco. All right, so moving forward, I'm putting this question to you, Zila, given your track record with digital innovation in the public health space. What are some emerging innovations that can help mitigate the health risk of climate change?
Okay, can you hear me?
Yes, I can hear you.
Great. So in terms of digital health innovations, we know that I'm trying to look for an example that would be most practical, because for me, I see the African health tech space as still emerging. But I would say our data analytics solutions that exist already that are being used by a lot of national public health agencies are critical solutions that can help to mitigate the impact of climate change. And specifically, I'll look at data tools that are able to like track and collate like meteorological data, so that you're able to like maybe monitor environmental changes, make predictions and modelings, to be able to map disease outbreaks, identify vulnerable populations. And lots of these tools are also incorporating like AI technology and big data, for you to be able to have, even when addressing any issue, you need to be able to make evidence-based decisions, you need to make solutions that are backed by fact and evidence so that you make sure that your solutions are targeted and also addressing the issue. But at the same time, especially for preparedness, which is a huge part of emergency response, you need to be able to prepare and plan appropriately, know how you're allocating your resources, especially dealing with like, even the brain drain. We can have all the wonderful health supplies and everything, but if there are no people that are around to attend to issues when emergency issues, then there's no response in quotes. So I would say the data analytics solutions are definitely playing a big role.
Awesome. I think Madam Timtayo is interested in also answering, providing some perspective to that question. So Madam Timtayo, you work with eHealth Africa, and for everyone that knows eHealth Africa, we deal with digital innovation. So from your experience and from your office, what are some emerging innovations that you think exist that can help mitigate the health risk of climate change?
Okay, so looking at the artificial intelligence, AI, machine learning innovation, so that speaks to some extent to what my co-panelist Zila spoke to. This has and is playing a pivotal role in climate mitigation efforts. Talking about AI now, and these AI algorithms have been used or can be used to analyze large data sets, including climate data, basically triangulating climate data, health records, environmental data, environmental factors to predict and detect early signs of climate-related health risk. And this is very, very important in being able to develop early warning systems that allow timely interventions. AI is also playing a role in precision public health intervention, because when you're able to predict, when you're able to triangulate data, then you're able to design and implement targeted interventions that address like the concerns or the needs or the conditions of the population. Earlier on, I spoke a little bit about renewable energy. So this is also an innovation that we're seeing that is helping to mitigate or adapt to climate change issues across board. And adoption of renewable energy solutions within healthcare facilities can also serve as a crucial adaptive strategy, like I said, to mitigate the impact. Access to energy, access to power is very, very important, like to quality of care. I think I mentioned that already. It's also very important to abilities to provide services in health facilities. So these solutions like solar panels, wind turbines, biomass generators offer a sustainable option the burning of fossil fuels that we see in generating electricity, or even the use of diesel or fuel generators across these health facilities. There's also innovations around telemedicine and remote healthcare. So this is an innovation that enables or allows direct service delivery, so to speak, to communities, to individuals, with reduction or without the burning of the fossil fuels and the emission of the greenhouse gases. So by being able to do remote consultations, monitor chronic conditions remotely, this reduces the need for physical travel, for instance, to healthcare facilities during emergencies, and enhances the access to medical care in climate-affected areas, particularly during climate emergencies or climate-related emergency settings. There's also the climate smart agriculture component. So we're seeing more and more climate smart agriculture tools that are being used, that are being developed and being used to address challenges with food security or food insecurity as it relates to climate change. So these are some, I would say, key innovations that are already in play and even emerging across board, that are helping us to mitigate the risks of climate change.
All right. Thank you very much, Madam Timotaya, for that extensive list of innovative solutions around climate change interventions. Okay, so I would like us to dive into, because we have about 12 more minutes, I'd like us to go into the Q&A box and answer some of the questions that have been pouring in. However, I need us to have a consensus that our answers will not be so robust. We can't really deal with everything right now, and I would like for us to be able to cover as many questions as possible. So I'm going to ask questions. I'm going to call your name, and then you just give us, a brief, summarized version of the answer. So I heard Zila mention something along these lines. And so I want to throw this question back to her. She had initially spoken about, she was giving an example of someone, trying to execute a campaign, and then you see that the day you're supposed to go to the community, the road has been, washed away by erosion. So someone asked the question and said, how does climate change exacerbate security risk for field staff working in vulnerable areas? How does climate change, this is for Zila, how does climate change increase security risk for field staff working in vulnerable areas?
Obviously, if one look, I'll use the Nigerian context, for example. Looking at campaigns that are targeted towards people maybe in hard-to-reach areas. Already, we know the issues with banditry, and all of that is there. And imagine, just like the example I used, is just access to the community is now disrupted, and maybe you're not able to access there, your plans are disrupted. Obviously, that puts you at physical harm, that's one. So that's the security risks. But then again, even the if there's flooding, for example, even you are a human being, you can be affected by that. So in terms of what you can do to help, once you see already, before you go for this kind of campaigns, you have your plans. And once you see something that is maybe not aligned with what you've already prepared for, the first thing you do is to, I would say, advise that you just retreat, first of all, regroup, and then assess the situation properly, engage who you need to engage with, the known professionals, if it's flooding or whatever the situation might be. If I want to give a real example, I remember there was a time in Kogi, I think it was in 2012, there was flooding and the road was blocked. People were not able to pass through. And I know that NEMA had to come. They came with some tractors, created another path through the bush, for people to be able to go. So those are like other agencies that are able to address the issue, not necessarily the health organization, but that's where the aspect of collaboration comes in play. And even with the security risks now, obviously working with the security agencies like the police and other security operatives will be really, really helpful.
All right, thank you for that time, well-managed answer. Thank you, Zila. Okay, so this question is for Madam Timitayo, and it's from Nasir Yusuf. He says, how would you specifically explain the impact of climate change on public health in Nigeria? Is there any evidence to find a relationship? Is there any evidence, either positive or negative? So to a Nigerian person, how do you explain the impact of climate change on our public health sector in Nigeria? Can you just give a brief
Okay,
answer?
so I would use the example of the disease outbreaks, right? With climate change, like I said, there's increased incidence of diseases and even spread. So let's look at, for instance, vector-borne diseases. To look at malaria, for instance, in Nigeria or in warmer climates where we're already prone to having mosquitoes or excess of mosquitoes, for instance. And this is also linked to the warmer climate that we experience here. Increase in heat also means that there's a possibility of proliferation of mosquitoes or more mosquitoes. And these are disease-carrying, vectors. We've seen outbreaks in recent times of, say, Ebola. We've seen COVID-19. We saw the Zika virus in recent times. All of this can be linked to climate change, because with the changes that we're experiencing, it's creating an environment for these vectors to survive or to be proliferated and to survive, which then means that it increases the chance of them spreading more diseases and people falling ill or catching the disease. So I would say that yes, it's evidence has shown that this is directly linked. Even when you look at, say, waterborne diseases, recently we had the outbreak of cholera in Lagos State, for instance. So even though it wasn't the reason for that outbreak hasn't been, pinpointed or communicated, but we know that with increased flooding, with increased rainfall comes increased flooding, and that also causes contamination of groundwater and things like that. And when this is ingested, we then start to see outbreaks of things like cholera, diarrheal diseases, and all of that. So I would say that yes, there's that direct linkage to public health and disease. Climate change directly links to that. Yeah.
All right. Thank you very much, Madam Timitayo. Okay, so this question is from Samuel Aliyu, and I'm directing it to Dr. John. So he said, I haven't heard any of the panelists mention the One Health approach, which actually ties all of the conversation around collaboration and effective collaboration, like Dr. John mentioned. So this is for Dr. John. What are the steps that organizations, what steps can organizations take? Organizations that need to apply a One Health approach to the issues around climate change and health. What steps can they take to apply a One Health approach to the issues around climate change?
All right, thank you very much. Now, One Health basically demystifies the idea of working in silos, which is the call for intersectoral collaboration, coordination, and having a unified action to promote health. So One Health approach is actually an approach to implementing climate change interventions. That's the easiest I can put it. So the ideas of One Health training the workforce, mainstreaming One Health in across government programming, taking the program approach as opposed to the sectoral approach. I don't know how you are doing it in the federal government of Nigeria, but in Uganda, we have shifted from working as sectors, like water sector, health sector, to working under programs. So we have a program, for example, called Human Capital Development. And under there, it has education, it has health, it has water, it has agriculture. All these things come under Human Capital Development Program. And it's very easy that way to get resources to work across a common good. In this case, if you're targeting climate change, and climate change and One Health, they are very, very hard to distinguish because already environment itself is a component in One Health. And environment affects health. So it's already affecting the health, environment, and the health is already One Health in itself. Climate change and health is already One Health in itself. So I would say these are very intertwined, and the One Health approach is the best approach to tackling climate change impacts on health.
All right, thank you very much. We have just 4 minutes to go. So I'm just going to give the 3 panelists 3 minutes each, 1 minute for each person. So by then it will be 3:59. So it's a general question. Having said all that we've mentioned today, give us your parting words. Where do we go from here? Talking about climate change impact on health. So I'll let Zilla go first, and then Madam Temitayo, and then Dr. John Bosco. So Zilla, could you go first? Where do we go from here? Next steps, what are your thoughts?
Since I'm in Nigeria, I'll speak for like our country specific. I would say that there's really need for us to build a resilient healthcare system. Like this is not just even linked just for the climate change events that might happen, but even like for other disease outbreaks or so. We saw what happened during the COVID-19 pandemic. Thank God it wasn't that disastrous in the country, but then people still died. It put a lot of strain on the resources. And I'm not currently following all these reports that assess our readiness for outbreaks or emergency response. But it will be really, really disastrous for a major event to happen, and then we're not able to prepare. It's not when something happens that you start rebuilding the hospitals or putting all those systems in place and start allocating resources. It's better we start doing the work right now. So, yeah.
All right, thank you very much. All right, Madam Temitayo, in 1 minute, what are the next steps for us?
So, for me, I would say next steps is looking at that multi-sectoral approach to addressing climate change and building climate resilient healthcare systems. I already talked about the policy environment and the domestication of these policies across subnational levels. So what we find is that the level of awareness really amongst individuals, even amongst professionals, even when you understand or you know what climate change is, what are we really doing to help mitigate the effect of climate change or to help reverse this climate change. So I think that in terms of the policy environment, that needs to be strengthened. Implementation of that also needs to be strengthened. And then we need to look at how as a country, how as a population, we continue to build that awareness and get people to that level of consciousness where they start to take decisive action, climate adaptive and climate resilient decisive action.
Okay, all right, thank you very much. And finally, in closing, Dr. John, please give us your last words.
Okay, thank you very much. I have messages for the common man, and I have messages for the actors. For the actors is that I know you are at the point in Nigeria, at the point of doing your vulnerability assessment for the country, and then which will inform the development of the national plan. So that's what I want to drive at. In that national strategic plan for climate change adaptation, you need to be keen to take care of all the things that will bring climate and health as a priority.
All right. Okay,
And
okay, you still have something to say.
To the common man is that everyone can be a champion. It's not for specific people, because climate change really affects everyone in whatever you do. So you have to look at what you do and how you can fight against climate change.
All right. Thank you very much, sir. And this brings us to the end of Insights webinar.